starting the timer, and here is the question. Right, so if you have read and understood, kindly begin your history taking.
Hello.
Hello.
Hello. Good morning.
Good morning, doctor.
My name is Dr. Ishfaq. I'm one of the doctors. Today, I'll be asking you some questions. Before that, may I confirm your name and age, please?
I'm Sandra. I'm 36 years old.
Nice to meet you, Sandra. Actually, today I have been asked to ask you a few questions about your condition. Will that be okay for you?
Yes, sure.
Okay, Sandra. Can you please tell me what brought you here in today?
So, doctor, I've got admitted to the hospital because I have an operation due. I'm going to get my gallbladder removed. But you see, I'm really scared and nervous. I've never been operated before, and I have never been operated, and I've never been in the theater before, and I'm super scared. And I'm also having difficulty in breathing, and I don't know why, but I'm sweating quite a lot.
Okay, I appreciate your concern. I'm sorry to hear that. But can you please tell me more about your condition? Like, is this happening right now, or it has been happening from quite a time, like 2 or 3 days, or have you experienced this thing before? Or it's starting. When did it start actually?
Basically, I've actually been dreading this moment. I've been told, I met my consultant before regarding the operation, but but after getting admitted since then, I'm just feeling super scared and nervous. I mean, is it going to be very dangerous? I'm not. I'm just super scared.
Oh yeah, your your concern is right. I appreciate your concern. I will get back to you on that point later, but I would like to ask you some questions before that. Okay.
Sure. Yes.
So can you please have you experienced any pain in the chest as well?
I do feel pain, but in the middle of my chest, that's it.
Okay, so your most important concern you are getting breathlessness. So did it come and go, or it's there all the time?
It's there all the time. It's just this dragging discomfort that I have.
I understand. Do you think it's getting worse, getting more worse, or it's getting relieved at any time?
Not really. There isn't anything that is relieving this. I'm just like this. I don't see anything that's improving the pain.
Okay.
On that level. Yeah.
Okay. So do you think there is anything which makes it more difficult? There is anything which relieves your apprehension, relieves your short of breath, something like that? Anything you have observed?
When I don't really feel that after I wake up from the morning, wake up from my sleep in the morning, I don't have this problem. But
Okay.
otherwise, there.
Okay. So is there anything is it? Do you think it's affecting your life?
Yes, doctor. It is slowing me down. You see, I get tired very easily and rest. and I'm feeling very apathic. So yes.
Okay. Have you experienced any cough recently?
Cough? No, doctor.
Nothing like that. Okay. Have been
No,
feeling fever or like ill or feverish recently?
no.
Okay, good. So how has been your appetite recently?
Since the time I've heard about the operation, I don't think so I've been able to eat properly.
Yeah, that's right. That's right. That's right. So have you experienced like observe any unintentional weight loss, like you have lost your clothes or some actually lost some weight recently?
No, no.
Okay.
But
Okay.
like so I've lost appetite, and also because of this gallbladder issue, I've not been able to eat properly. So I think I might have lost weight, but it's not very remarkable.
Okay, okay, it's not remarkable. So, do you think this breathlessness is like you're getting more breathless when you sleep, or during sleeping, you are experiencing any kind of gasping, or like you're hearing your heartbeats? Is there anything like that you have observed?
When I go at the end of the day, when I go to bed, I can feel my heartbeats in my ears. I can feel the palpitation.
Okay. Okay, so do you get more breathless when you are more anxious? Like you said, you're going to have do this operation. So do you think whenever you think about that, you get this breathlessness? This is increasing in intensity.
Yeah, it increases a lot. Yes,
Oh,
I'm very
mhm.
worried, because you see I shouldn't
Right.
be so affected like this, but
Yeah.
like I told you before, I have not been in the operation theater before, so the whole thought of it scares me.
Okay. Do you have any other condition you see your GP for?
No, not really.
Okay. Do you take any medications?
The occasional medications for the gastric pains that I have.
Okay. Do you mind if I ask you some personal questions?
No, sure. Go ahead, doctor.
Thank you. So, what do you do for a living?
I am a I'm a teacher.
Okay, great. That's a really nice profession. Who is at home with you?
My husband and my 2 children.
Okay. So do you drink or smoke alcohol? Do you drink alcohol and smoke cigarettes, anything like that?
No, I don't usually. I don't smoke at all, but the alcohol only occasionally with friends.
Okay. So what do you think? What might be causing you this issue?
I don't know, and this heaviness on my chest, and this sweat, all of a sudden sweating and everything. I'm like super scared. Could it be something grave, perhaps? I don't
Hmm.
know.
Okay. So this is your biggest concern. Any other concern other than this?
What about the operation? I mean, actually, if you could enlighten me more about the operation or something, perhaps
Okay.
I'd feel much better. I'm not. I don't know.
Okay. I would like to get back to that later on. Now, I would like to ask you a few more questions. Like, so what are you hoping us to do for you?
uh, Relieve me of this discomfort, because it's actually driving me nuts. So yeah.
Okay, that's right. So, is there anything else you would like to tell me that I haven't asked you, that you get confused anywhere? Anything like that you want to tell me more about anything?
No, not really.
Okay, thank you. Thank you very much for your time. Is there anything else I can help you with?
No, doctor.
Okay,
Not yet.
Can you
okay, thank you.
summarize
Thank
your
you.
case now, please?
Okay, today I have been asked to, today I have asked a history from a 25-year-old female who is due to have lap cholecystectomy. She has been experiencing short of breath, a lot of sweating from past 2 3 days. It's getting aggravated whenever she thinks of surgery, and she's not experiencing any. She has not been experiencing any cough, any sputum, any chest pain. She has not lost any weight as well. She has no past medical history, significant past medical history, no surgical
So,
history.
in your opinion,
So,
her shortness of breath is due to What reasons?
So in my opinion, considering this situation, I would like, I think she's having due to the anxiety, she's pre-op anxiety related to the
Okay.
operation she's due to have.
Would you also consider any inguinal pain or
I would also
pneumonia or
like to rule out,
pleurisy?
pulmonary embolism, MI,
Yes.
any chest infection, any malignancy as well.
Okay. So what should be the management for this patient? Do you think the
So
operation should go ahead?
yes, after ruling out everything, or there is no organic cause of this shortness of breath and this, and I would like to contact her GP as well regarding her previous conditions. The notes I would like to have, and after going through all the investigation, if there is nothing wrong with that, I think we can go with the operation. And I would like to discuss this thing with my consultant and the anesthetist and the GP as well.
Okay. Would there be anything else you would want to arrange for the patient?
I would
Do you
like
think
to.
patient needs any counseling with the psychiatrist or psychosocial counseling?
I would like to repeat the investigations and arrange an echocardiogram in this patient angiogram, and
Yes.
I would reassure myself the patient about the whole situation that it's not a big deal. This is normal in your case, and to decrease her fears, allay her fears, I would like to have a psychosocial therapy before the patient goes for the operation. I would like to suggest that we should indulge her friends and family more into this, so that she feels like it's her home, that norms like home, so it's her apprehension and can decreases with the time. So after that we can go with the operation.
Good. Thank you.
Thank you
Yes.
very much.
Thank you so much. Yes, feedback. It was good. You ruled out, but one thing I was thinking, did you rule out the severity of her breathlessness?
The
How many steps she can walk before
yes,
she
the distance.
experiences, or she
Yeah.
climbs stairs?
I told her, is there anything? She said,
Makes it
otherwise she is
worse.
fit. Otherwise she is fit. She is not. I told her, like, is it affecting your life? She said, no, it's not otherwise affecting her life. It's just breathlessness. Otherwise she can go around and all
Okay,
those
did
things.
you ask her about the palpitations? If like they were
Yes,
palpitations were
Yes,
associated with
yes,
breathlessness?
yes,
yes.
ma'am, he did.
Okay, yes, good. Yes, I missed. All right, good, thanks.
Yes, ma'am.
Thank you.
Dr. Ishfaq, you did really well. It is very good and thorough history taking, so it is
Yes,
good.
but 2 minutes extra he took.
Yes, ma'am. About the
So,
time.
yes, time. I would want to request you to write down all the questions that you have to ask for each session, and then practice them to make them, yes,
Yes,
to
ma'am.
answer them within the given time. This is very important, because the more you'll practice, you should have a structure in front of you. And if you want to use the same structure for every station, at least then you
Yes,
should practice the answers within 6 minutes,
yes, ma'am. I'm trying to get it
Yeah, we are
natural. That's why,
practicing.
ma'am.
Yes,
Otherwise, yes, ma'am.
yeah,
Thank
we
you.
are practicing and we are getting
Your
better.
practice. Hope
Yes,
we go to better.
hopefully,
Yes, ma'am.
yes, soon we'll be
Hopefully.
in the limit.
Yes, ma'am.
Inshallah.